Hello everyone, Sat Sri Akal, and welcome back to the Punjabi Pod, episode 14. We're on episode 14, right?
I think so.
Today's episode is a very important episode because we got a lot of requests, and I know we've talked about it a few times to have an episode like this, but today we're going to be talking about women's health. Now you're going to be wondering, what am I doing on this episode? I'm here to learn. I'm here to learn all about the women's health, but we have two professional doctors who are women themselves, who practice this every day and see all the circumstances that happen and the things that happen. So I know this episode is mostly going to be in English, right? We're going to try to do as much as we could, but you get as much information out of this as possible. If you have questions, make sure you comment them down below and let us know, and email them or message us. We're going to do more episodes with. But today's our guests are Dr. Kernjeet Sandhu, as well as her friend, Dr. Chavali, who practices has a family practice as well, right? But I'm going to let her do her own introduction and give us a little bit of background on herself. Go ahead.
Hi, everybody. I'm Soujanya Chavali. I am a family doctor. I work primarily at Harbourview Medical Clinic as a family doctor. As well, I have a university and teaching affiliate, and I'm trying to... No, I'm not trying to. I am the education director at the Northern Connections Medical Clinic. It's basically the Northern program at the University of Manitoba that's training family physicians. I'm also on the planning committee for the Fridays, which is a professional development committee, which focuses on professional development activities and educating family physicians like ourselves.
Good.
So thank you for having me on the show.
No, thanks for coming.
Yeah. So for me, audience knows I do a lot of addiction medicine. So that became my focus years ago, but I still have a lot of, especially with the Punjabi community, I capture a lot of the women in our community that want support in this world of sort of understanding PAP screening and oral birth control, contraception in general. But what I find, and the reason why I got involved with Dr. Chavali, is sending women to you, because that became an issue for me. Having been so focused on addiction, I just haven't been practicing gynecology and all that stuff regularly. So in my sort of northern practice, I guess you could say Garden City, where I see a lot of the Punjabi community, one of the things that I've seen, and I think the community struggles with, is the lack of knowledge surrounding contraception in general, and also just the high rates of abortion I see. And again, I'm sort of doing the treatment as best as we can, given what my training and background is, but of course, leaning on you for support a lot. Like I've even sent referrals from Waterford. So I thought we could open today with just talking about a little bit about not so much, even options for what contraception exists out there, because I feel like the pressure is always on the women, especially in the Punjabi community. Like I feel like it's always the woman coming in. And I remember the last time I mentioned a vasectomy to a man, he just thought I was crazy. They've never even heard of it. The term vasectomy in our community is like, it doesn't really exist. Yeah. So I thought I would have you on to sort of speak to, what that looks like for you. Like when I send you people, or even the people you see, because that's your niche, know?
So interestingly enough, I never thought that women's health would be my niche because, as a female family doctor, people expect to come to you and talk about contraception. But with our communities, as you were mentioning, there's a lot of reluctance because people don't think, oh, I don't need to get screened. Yeah. I don't need to see a doctor when there's nothing wrong. That's the main concept people are coming from. So there's a lot of backlash when I start talking about contraception. I use pap smears as a guide, sort of like a pathway or a segue into, hey, what are you using for contraception? What are you using for birth control? And people get offended sometimes. So I just have to cautiously broach that subject without hurting anybody's sentiments. Remember, cervical cancer is the 4th largest cause of cancer globally. 350,000 women die from cervical cancer every year as per WHO.
Yeah. That's crazy.
Wow. And it's the 4th frequent cancer between childbearing ages, between 15 and 44 years of age. So if we can do something to raise awareness and talk to young women who are coming in and use this opportunity when we're screening for pap smears for cervical cancer, which is a very preventable cancer. to talk about birth control.
Yes,
That's
it's really
a plus.
interesting, right? Because I see a lot of immigrants and they don't do pap screening in India, especially the girls that come from the ones that I see from Punjab. I mean, they've never had it. They don't even know what it is.
Yeah.
And so then you have to talk about the anatomy and explain to them what is your cervix? Why are we doing this?
Right.
What does it mean?
Right.
All of that. So I find that really interesting that those are the numbers because
It's interesting that you mentioned that because I have a lot of women that come in for pap smears have no idea what a pap is. So they'll sit there with their pants and underpants still on when I come into the room. I'm like, do you know what this test is? You know?
Yeah.
There's
Well,
a lack of awareness,
so it's funny because I'll actually tell them
Yeah.
what will happen. I have the drawer, the drawer, we have the thing. I'll show them this is the brush.
Yeah.
This is what they do. It's where it's from in your body, so they know
Yeah.
what, so it's a little bit of an sort of invasive, sensitive procedure,
Yeah.
so that they know what they're walking into, because a lot of them, like you said, don't, which is, I just find it sort of shocking, right? Because born and raised here, we grew up it's what you hear, right? And then there's the whole HPV vaccine.
That's right.
We offer it to women in those age categories, but again,
So
these girls
again, for
don't.
those that don't know what HPV is, it's a virus that is in various strains, like any virus would be, but certain strains are more implicated in cancers.
Yeah.
And if you're getting a chance to get vaccinated in school, great. But those women that are new immigrants don't really have the knowledge or the know-how as to what to ask their doctors about. So when they come in and they're high risk or they're in promiscuous sexual activity, for example, they're of a low socioeconomic status or they're smoking, right? Sometimes we forget to ask Indian people, East Indian women, hey, do you smoke? Very frequently I will get into these discussions
ask.
and you're like, you're like, hey, I don't think you smoke, right? And then they're like, why do you say that? I do.
Oh.
You know, I pack a day, half a pack a day. Like I'm just saying, like, assuming is something we should absolutely not do, especially in our line of work. You know this better than I do.
Yeah. So what I think is interesting is why are, and this is my understanding or experience, is our women, Punjabi women, and I speak to mostly Punjabi women because that's mostly what I see, don't really want to be on birth control, which is why I'm giving so many of them abortions. So what is there a trend there? Why do you think that is? Is it because they don't want to take a pill?
I don't think it's as simple as that. I think they haven't accepted the fact that they're fertile. No, I think it's the fact that there's so much taboo placement. There's so much like negativity surrounding like pregnancy. We don't talk to kids about sex ed, for example.
Yeah.
You know, we're a land of 1 billion and some people. We're the land of Kama Sutra, yet we don't talk to our kids about safe sex practices. And that's insane in my mind. I had a 6-year-old girl, I was telling them earlier on, I had a 6-year-old girl come into the office today and she was telling me about good touch and bad touch. And I'm like, there you go. That's a parent that did their job properly.
Yes.
Because honestly, if you're not teaching your children about what's right and wrong, whatever facet that may be in their childhood, then you're not doing a good job.
Well, and again, that's another topic which, again, you've touched on is child abuse. And I speak to mostly the Punjabi community, but Indian 100%. Community, like the rate of it in homes by relatives is insane.
Yeah.
So, and that's part of the picture. But what I find, and the other piece of it is you write the prescription and then they still don't take it.
So you did ask me that question. So I don't know if it's necessarily that they don't want to take a pill or they don't want to get a shot or anything like that. I think it's the taboo nature of, I'm going to be on birth control. I'm going to be on something that will help me normalize my periods. There's lots of myths surrounding about being on birth control and not getting pregnant.
Yes.
They've seen somebody who has polycystic ovarian syndrome, for example, that hasn't been able to get pregnant, and they've seen them being put on birth control, and they're still not getting pregnant because of the disease process and not because of birth control. So there's a lack of like connect between two different ideas. And I guess rather than raising awareness for your own family members saying, hey, it's okay, you can take this pill. And in fact, it regulates your ovulation so that you can have better chances of getting pregnant. Instead of changing the dialogue that way, it's perceived as, you're on birth control? Oh my God, that's weird.
Yeah.
Because birth control is not just birth control, right? It's to help regulate your periods, for example. It's being used for acne, for example.
Yeah.
It's being used for contraception, of course. There's multiple benefits of being on birth control, right?
Now, what about one of the concerns I have? A lot of women come in and just acne, weight gain.
Yeah.
I mean, but that's specific to the certain types of birth control, right?
Interestingly enough, not. There is some truth to gaining weight on birth control. I won't lie about that. But I think your risk is equivalent when you're not having periods properly, when you're not exercising and you have sedentary lifestyle.
Right.
So, and we were talking about this earlier, having these kinds of fad diets of like, I'm going to go on keto. I'm going to go intermittent fasting. I'm going to go on Ozempic. I'm going to go on all these pills, medications to help. Nothing, and I repeat, nothing substitutes lifestyle modifications. Nothing.
No, of course.
Nothing.
Yeah.
Exercise, having proper diet, and having nutritious food always trumps any sort of fad diets that are available out there.
I think one of the things that's important for our community to really think about in general is just the purpose of birth control, right? Like, it's like what you just said. Like, it's the balance of, well, would I rather be pregnant or would I rather deal with a little bit of weight gain?
Good question.
And could I just sort of offset my weight gain by maintaining a healthy lifestyle? And that way, at least I'm not pregnant looking for, an abortion in 3 weeks, right?
And I see a lot of that.
I see a lot of it too. And what's shocking is sometimes I have a woman come in, we do an abortion, and this happened to me this year, and 3 months later, she's back pregnant again. And I'm like, what happened to the prescription of birth control that I gave you in February?
Right.
It's now June and you're pregnant again. What did I miss? You know? And so it's become such a, I don't even know if I should say trend. Like, that just trend sounds like something positive, which it's not really positive, because I think these women are really taxing their bodies by putting themselves through repetitive abortions.
And think about how much physical, mental, emotional stress that is on the body to become pregnant when you don't intend to carry that through term.
No.
It's a lot of emotions. I have several women coming to the clinic. Oh, I made a mistake. No, it's not just about making mistakes. It's about learning from your mistakes.
Yeah.
And, especially people that I see the opposite end of the spectrum. I see a lot of people with infertility struggling to have kids. And you're sending these people to Heartland and they're wondering, I'm 29 years old. Why am I not getting pregnant? I had a girl, pleasant girl, beautiful girl, not overweight at all. No, like, she had multiple investigations done here in India, had a hysterosalpingogram, all these kinds of invasive tests. Can't get pregnant. And then there's these 40-year-old women. I'm not trying to blame I'm not placing judgment calls, and it's your body, it's your choice.
It's what we're seeing.
But when you're clearly not wanting to intend a pregnancy, then make sure you're using contraception.
So what about the flip side of it? And I know, this is, of course, you sort of open a can of worms, but what about the role of the men? Like, you have a family that's settled. The people are in their late 30s, 40s. Clearly, they're still sexually active.
Yep.
And you have men not being a part of that picture. I feel like if the women bear the children and have these babies and go through all this stuff with their bodies, could there be some role of the man, let's just say, to have a vasectomy or be done with having babies but still having sex, right?
Yeah, but I guess
that is also something not very well received in our community.
Agreed.
Right?
Agreed. I cannot think about the last time I had a discussion with an East Indian person, like a man, about vasectomy. It just doesn't happen. I don't even broach that a subject. I'm guilty of this, but I know what the response is like.
Yeah, you know what the response is like, and I've never experienced the response. So I did it once, and I got the response, and now I know.
What was the response?
The response is just this, like, oh, no, you can't touch my man parts. Like, oh, no, ye feel hunda, like, aapa kuch galat kar rahe hain. But I think if you look at the actual physical vasectomy procedure, we're not doing anything to affect erections and all those things.
Nope.
We're just stopping the flow of sperm, from what I understand.
That's my understanding.
Right. So
even if you educate them on the process of this, they still think it's like a manhood
this
thing?
red line. Like, you can't, that's just not a territory you
and
want
is
to
it?
go to.
And what if, have you guys recommended them to a male doctor? Would they speak to a male doctor?
No, actually, I didn't do that.
Yeah?
I have.
Okay.
I have.
Yeah.
I would generally do that because
a men's clinic?
Yeah. I had a patient who had asked me specifically, I'm not comfortable talking to you about my man issues. Can I be seeing a man? And I'm like, you know what? I respect that. Talk to somebody. It doesn't have to be me, right? Like, I'd rather your awareness of the issue goes up. And, I don't want you to feel limited in your potential if that's something you would consider. right? I also wanted to talk, while we're on the subject about awareness and things, I see a lot of people, especially our Punjabi community, where the women are so pressured to have a boy child. Is this something that you guys are
God.
seeing too? Or you are seeing, I
see a
should
ton
say?
of it.
Yeah.
I mean, I've sent couples to Heartland, and actually some couples just come to me and say, we can't gender select here, so we're gonna go abroad.
Oh my goodness.
Like Dubai, different countries where they can try to gender select,
Yeah.
pay under the table. Like, I don't know what's that. I mean, I shouldn't say I don't know what that's about. Of course I know what that's about. It's just it's the male dominance and the sort of patriarchal nature of the culture. But it's kind of shocking that it's still happening in 2024 in Canada.
I had a lady who outright asked me, she's like, what kind of vitamins can I take to make sure I have a boy this time?
I know.
And I'm like, you're in your 40s, first of all. Again, no judgment, right? Like having children at any age is absolutely great and perfect. But it was that she wasn't ready. She actually wasn't ready to have the child, but her mother-in-law was putting pressure.
Or her
husband
had one or
was.
two kids. In
She
the home
had
that
two
were
girl children.
Yeah.
And the mother-in-law was putting pressure on her. And she's like, are there vitamins that I can take? Are there ways that I can increase the potential of having a boy child? And I'm like, listen to me. You can't do that. First of all, it's illegal.
Yeah.
Gender select. Secondly, like, what is the guarantee that like it won't be a flip coin? And again, you have a girl. Right? Are you ready to physically have another child? And she's like, no.
Child, yeah.
She said to me, no. And I'm like, then why are you burdening your body based on someone else's expectation?
It's because of what we've talked about in the past. You have these joint families, especially in our community. I mean, I don't know how much you see it in other communities, but I feel like in our community, you've got these joint families, and the husband and wife are not a separate entity. They're just part of this larger entity of the mother-in-law, the father-in-law. And then you have the in-laws putting pressure on the girl because she's the only one that can hold a baby in a pregnancy. And that pressure's all on her to create a male child with her partner for the name to be carried on. What do they call it? Come on, Pidi. Pidi tarni chahiye. The Pidi.
I love that Pidi.
Pidi is like, Sandhu.
Yeah.
Like Pidi tarni chahiye, right? So in the girl's case, like in our case, in our family, you marry the girls off. It's done.
Yeah.
So Sandhu ends at me, right? According to my dad. So the pressure is on the males. The pressure is on the...
Lots of pressure, guys.
Simi's just sitting back there.
So I think that, and I think this is a fascinating topic, which we could talk about for an hour. Like there is so much pressure for these women, and maybe that's not the reason they don't want to be on birth control, because they're trying to have a male child. Like I don't know that there's an easy way out of that one, because that cultural pressure is just insane.
Yeah, I have women that are very aware, and I have women that are absolutely not aware. And I deal with this dichotomy all the time. And I'm thinking, like, I try to educate people while I'm doing the PAPs. I'm like, hey, have you thought about birth control? And most of them say no. That's how they start.
Or some of them say, I don't even know, what is that?
Yeah, what is that, right?
That? Yeah.
What is a PAP test? Like some of them don't even know it's like a speculum examination.
Yeah.
Right?
Oh, yeah.
So, yeah, I don't...
I think what we'll do is break and then come back and do our next segment.
Yeah. Let's do a little bit of a break here, and then we'll come back to this episode and continue it.
So one of the things I want to talk about is types of contraception. So we briefly touched on oral contraception, a little bit about the weight gain and the acne. Tell me about other forms of birth control that exist for the community.
Sure. So even within oral birth controls, there are progesterone-only birth controls versus combined birth controls, which have estrogen and progesterone in them. So generally, the common practice is to give combined contraception to women that are not breastfeeding or have specific preference, because progesterone-only birth controls are very time selective. So, for example, if someone's breastfeeding, it does affect the quality, quantity of the milk that comes out. Yeah. That's why in a breastfeeding woman, you want to put them on progesterone-only birth control. Yeah. And it has to be taken within 3 hours of the last dose. So it's very unforgiving in that. So there's a chance of getting pregnant if you don't take it properly. right? So combined
But
birth
there is
control,
birth control for breastfeeding women.
yes, there is
so let's
absolutely
highlight
And-
that point.
Yeah, so I generally use the time at the postpartum visit, which happens around 6 weeks at a time. If they're not seeing a gynecologist, I use that opportunity to talk about, hey, what are you using in terms of birth control? Are you guys back to having sex again? Common things that people don't really want to talk about, but need to talk about, right? So that's the oral side. And of course, there are contraindications, and I'm not going to get too deep into that. There are people that can be considered not eligible for these kinds of medications, right? Briefly touching on them, if they're smokers above the age of 35, if they've had previous leg clots, if they have hypertension that's unmanageable, if they have active liver disease, active breast cancer, if they're actively pregnant, for sure, don't use
No
contraception.
hormones,
So there are contraindications for people, and of course, as a physician, you have to use that kind of a hat to determine who's this going to be good for, right? And that's part of my job, is making sure that you're picking a contraceptive for somebody that's going to be sustainable. It's like diet, guys, right? Like, you want to choose a diet that works best for you,
your body,
right? Just because intermittent fasting works for you, it might not mean anything for me.
Right.
Anyways, back to the contraception aspect. There are injectable contraception.
Yes.
That's Depo-Provera. That happens every 84 days, every 3 months or so. I like this particular form of contraception for young kids that are not very reliable to take a pill every day. Right? That's part of the issue, is compliance, right? If somebody's not wanting to buy in the fact that they have to take something consistently, well, they're probably not going to do it, right? So for kids that are exploring themselves, trying to get into multiple relationships, I might use it there. And I'll say, hey, come back in 3 months. But the problem with Depo is it causes a lot of irregular bleeding, and you don't want to use that for a long period of time. Because it tends to thin the bones, right? It does. And also in people that have severe depression, I would absolutely not go there. It's progesterone only.
It's only progesterone, right?
Only progesterone cause weight gain. It can cause mood to worsen, right? So you don't want to use this for a long period of time.
No.
But it is
good
there
in that population.
Yeah, good in that population. And then there's the patches. The birth control patches are also combined with estrogen and progesterone, and you can apply it on any part of your body except for the hormone-rich areas, which are the breasts and the uterus, right? Like, you can use it on the bum, on your legs, anywhere it sticks, you're absolutely fine to do that. And I find that it's very well tolerated.
And it's good because you don't have to take a pill every day.
You don't have to worry about, you change the patch every week, right? And you don't have to worry for a week. So a lot of women like that. There's the NuvaRing.
I was just going to say, NuvaRing is still around.
Yeah, I don't have too many women using that, because especially
I thought that was a really good
population.
invention back in the day.
Right?
And you put the ring in, you take the ring out. Right?
But again,
and
it
it's every 3
every
weeks.
week. Every week you put it in, and then the fourth week is the withdrawal.
Is your withdrawal bleed?
Exactly. But again, this goes back to our cultural
But you have to be comfortable.
You have to be comfortable touching yourself down below, putting something
which
inside.
Culturally, our women don't even. I have a couple women that don't even know what a tampon is.
I know. I know. This is why I'm saying I'm not seeing too much of that taking importance.
NuvaRing would not be
it's not for everybody
in our community.
I like it. It's quick and easy. Women that are comfortable with their bodies and their sexuality, absolutely.
I say if you
go
can
for
use
it.
a tampon, you can use a NuvaRing.
I agree. So that's that. There is the IUD, which is a little bit more invasive. Like,
that has to be
inserted by a physician that knows what they're doing. There's the hormonal version of it and the non-hormonal version. A lot of women don't like hormones, and so they'll say, "I don't care about the hormones. I don't want anything hormonal like that." So I'll go with the copper T. But the only thing with copper T is it can have heavy menstrual cycles, and it doesn't happen with everybody. But when it does, it's annoying.
So you know what I find? The trend in our culture, the community, is cop tea. Punjabi women like it because they bleed.
Yeah.
There's this thing that I want to bleed every
true.
month, which I cannot understand.
Yeah.
But they want to have a
period.
cycle every month. And if they miss a month, they're, right?
Am I pregnant?
Yeah, so if the pregnancy test is negative at home, they still come in saying, why didn't I have my cycle? And it's like, can you just give it a minute? Can you breathe? Can you wait a cycle? No, do my blood work, get an ultrasound. I'm like, by the time I order your ultrasound, you're going to get your period, right? So I find the COP tea is very popular in our community.
And they're excellent. They're a great cost-effective, great way of having contraception, because the fail rate is almost nil.
And they're in
right?
for-
if it's inserted properly.
Right. And they're in for
5 years. 5 years. There are some that are good for 10 years.
10.
I go with the 5, the standard,
Yeah.
or the
10 years.
the
You
mini.
can have it in for 10 years.
Yeah, you can have something in. I personally like the 5 years because, women, they decide at some point that, oh, I want to have another child, right? Then take it out.
Then take
get
it out,
pregnant,
right.
right? Yeah, I guess you could do that with the 10-year also. Like, it's bang for your buck.
Right.
Okay. You don't have to think about it. You don't have to worry about it. It's done. Okay.
And
Mirena
then-
is similar.
Mirena, yeah.
Mirena is great.
that's hormones.
It's hormones.
Yeah.
And 80% of the time, women don't even have their menstrual period after period
Yes.
1, which
I
is
think
wonderful
that's
for some.
genius.
It is genius.
You don't have a period. You
Yeah.
have an IUD, and out of sight, out of mind.
Out of sight, out of mind. But some women who
But
have
they
heavy
want their-
periods.
yeah.
Well, some women who have heavy periods and they're iron deficient also have this is better for them.
Yes.
And the final one I want to talk to you before I end is the Nexplanon, which is the
In the
implant
arm.
behind the arm. It's like an IUD, but doesn't require a vaginal exam. So that's a great hit. A lot of people don't want those invasive exams.
You probably haven't even heard of that. So,
Wait,
yeah,
what's
in your
that?
arm. It goes in your arm.
Behind
it's
your
an
arm.
implant.
Yeah, it's an implant.
Yeah.
So it's like a same-day procedure. You go into your doctor, whoever has qualified to do this, make a cut, put the implant in, suture it up, done.
And good for how long?
This is like a hormone?
Yeah.
Yeah, and how? For how
3 years is, the data is good for 3 years, but it can be used up to 5 years.
So many different things that you think people would, put a
Yeah.
lot of
So,
them.
I think that was good that we touched on that. There's oral stuff, there's
Injectables,
injectable stuff,
patch.
there's intrauterine stuff,
Yeah.
there's a patch,
And
there's a ring,
Nexplanon.
there's a dermal thing you could do. Like, there's a lot of different options out there. So that was good.
And
I think-
condoms, of course. Sorry.
And of course, condoms.
Yep.
Just our
Wear a
routine
condom, man.
bread and butter,
97%.
the basic.
Yeah.
Yeah.
And
Protect
I just
yourself.
want to stress again, sorry, one more
No,
thing,
go
guys.
for it.
I want to stress, though, that oral contraception, all these kinds of birth controls that we just talked about, don't prevent against STIs.
Yes.
Okay, so
Which we
if you're
will talk
on an-
about
yeah.
STD screening,
Okay.
STI screening, sexually transmitted infections at some point again.
So if you're in a new relationship, make sure you're using backup form of contraception, which is a condom. Thank you.
Get a condom. Okay, we're gonna go on break and then we'll continue for the
can come
next
back.
Yeah.
the next little segment there. Okay.
Yeah.
Sounds good. Let's
Thanks.
go. Okay, so welcome back from the break. I know we talked a lot from the first half there, and I'm learning a lot. So that's a nice thing. Where I'm learning, so it's good. And that's what I'm here for. This episode is just all you guys talking about the important women's health, and I want to start. And you know what? We're gonna dive into a little bit of the common myths that are found in what would you say? Sorry, what was-
Fertility.
fertility, right? And so we're gonna get into that. So I'll just let you guys do your thing
Yeah.
and go from there.
So one of the things, what I found a lot is what people come in and the stories they tell themselves, right? Which is our sort of internal dialogue.
Right.
So you tell me what you see, and of course I'll chime in when I am reminded of something. But what do you see in practice in terms of what people think about contraception, about fertility, about their cycles, their ovulation days versus not ovulation days? Tell us about that.
Good question. So I see a lot of myths that are surrounded with women's fertility issues. So if women get pregnant and they weren't expecting that, I always ask, like, hey, are you using contraception consistently? Because that's the key there is consistency, right? Women frequently tell me, oh, my husband pulled out at the right time, and so I'm not pregnant. And I'm like, well, no, it only takes one sperm to meet one egg to make a
And you're
zygote,
done.
and you're done.
Yeah. So that's interesting. So the pull-out method. I hear a lot about that, especially in our community, because people don't want to get on birth control. People don't want vasectomies. And you know what? They don't even want to use condoms.
Right.
Yeah.
And I just find the whole concept to be crazy because, like you said, it takes one sperm. So even before you fully ejaculate, you have a little bit of stuff that comes out beforehand.
Right.
That also carries sperm.
Yes.
So how are these people getting off thinking, well, he pulled out, so there's no 100%, I'm not pregnant.
Yeah.
Right? That's the problem.
Yeah, it's the lack of awareness or talking to your friends rather than talking to your physician about
Yes.
what's actually evidence-based versus what is hearsay,
Well, you don't
right?
need a birth control prescription, just have him pull out.
I have women that come in who are recently postpartum, breastfeeding, thinking, oh, that's foolproof.
That's another one.
And I don't need to be on birth control. I'm breastfeeding. No, that happens frequently. I had a girl who was 3 months postpartum, was breastfeeding, got pregnant.
Yeah.
And she's like, well, I thought I was missing my periods because I just gave birth. I'm like, well, you have to protect yourself. If you're not intending on having your kids so close to one another,
then that's what you need to do.
and you do need to let your body recover, even if it's a vaginal delivery.
Oh my God.
Right?
Yes.
C-sections, you want to wait longer.
And you know what I find really interesting is how the woman, she just hands that power, control, whatever you want to call it, over to the guy. How do you let a guy pull out and decide? That's a huge, he pulls out, he's done. It's on you if you get pregnant. Right? Your body's carrying it. Mm-hmm. You're going to go through the abortion or the pregnancy.
Right.
It's your physical body that will experience whatever the experience becomes, be it an abortion or a pregnancy. So I'm just fascinated by how women can allow that degree of, this again goes to screening before having sex, right?
And
STI
also
screening.
It also goes back to culture, right? This is a male-dominated society that we had lived in India. And, there's a certain dialogue that comes along with that. Oh, your husband is always right. Your dad is always right. Your brother is always right. Whenever you're sending women out, you're sending them with their brothers or fathers or boyfriends or husbands. And it's never oh, you shouldn't go out alone at night. Yeah. Why not?
Yeah.
Anyways, that's a whole different discussion.
That
needs to be
is
changed.
What translates over into what we see in our community practices, because then you have this population of people that just don't have a clue.
Right.
Mm-hmm. And are relying on the man to pull out, which I'm sorry, ain't a great...
Exactly.
That ain't really...
The pull-out method doesn't work.
And I don't know if some of these women know what's to be expected in a therapeutic abortion. Yeah. Taking a pill is not as easy as you think it is.
Yeah,
there's the aftermath.
The aftermath of that. So let's talk just briefly about that, because I prescribe a lot of this, just giving that abortion pack out. So tell us a little bit about some of the aftermath.
Bleeding. It's a lot of bleeding that women don't expect. Sometimes the products pass, depending on what stage of pregnancy. So if you're not anticipating seeing that in your toilet bowl and you're seeing part of the fetus pass, that is very traumatic. Yeah. Abdominal pain, nausea, the pain, the bleeding, all of these things people don't anticipate.
Yeah, so
and sometimes you can retain the products.
Yep.
And that becomes a whole issue in itself, where you need to keep getting pelvic ultrasounds to make sure that all of that is cleansed.
Passed. And then if it doesn't pass, you need a procedure to get it to pass. And if it stays in there too long, you're at
become
risk of
septic.
infection.
Yeah. And you can die.
Is it, sorry?
Yeah,
is
for
it
sure.
the same when miscarriages happen?
Something like that. But with miscarriages, sometimes it's unintentional, right? Mm-hmm. People sometimes don't even plan that, but because of some traumatic event or some sort of a selection process by the body, it's just not able to sustain that pregnancy. And that goes out. And abortion, you're right. So therapeutic abortions are similar in a sense to some of the symptoms that you people experience. And so some of the women that come in are so young, they're not thinking that this would cause some sort of fertility concerns in the future, right? Depending on how the DNC was done and who did that, or how far along you were in the pregnancy, it can have a lot of complications.
So what about women who come in saying multiple abortions, that affects their fertility?
Oh, absolutely, it does.
Yeah,
it affects the quality of the future pregnancies. Absolutely.
Right. So I think that's another myth. Women just think they can keep having take a pill. It's 2 pills, one done the first night and then 2 the next day, whatever that thing is, and they just think that they're fine after that. They'll just bleed and cramp for a couple of days, and then they're on their way, and they can just. I have girls in their 20s having multiple abortions. Yeah. And they just don't think about the future and what effect that may have on their future actual fertility when they really want to get pregnant.
Exactly. And these are the kind of women that come back and say, hey, I'm trying for years now and I can't get pregnant.
That's it.
And I had a therapeutic abortion X time ago. And again, I don't want to, I'm not here to judge, but I'm saying if you're not intending, if you're not intending to get pregnant, the answer is simple. Make sure you're protecting yourself. Like you said, a man's work is done when they're done having the sex, but it's the women's sort of the women
responsibility.
that responsibility when what happens afterwards.
I know.
Right? Are you carrying this pregnancy? Is this someone that you're casually seeing on the side? Are you there's a lot of stuff and emotions that get invested.
Well, the other piece is when he pulls out, like just going back to the stress of what a woman's body goes through. So he pulls out, and the next thing you know, there's some of them take the morning after pill.
Yeah.
Because they're not sure if he pulled out on time.
Yeah.
So then they're like, oh, there's only a certain window in which I can take the morning after pill. I better just take it. But that's not exactly healthy either.
I'm glad you brought this up because morning after pills don't work for a certain BMI.
Oh,
like above 90 kilograms, it's as ineffective as not taking anything, So copper teas are a great way to, do emergency contraception if it's inserted properly. Again, but you need to have the expertise of how to do that. And a lot of physicians don't have that know-how.
Well, and the thing I find, and so that's the thing, you take the morning after pill, but then what about the stress of waiting for your next cycle? You've had sex now, you're not on birth control, he pulled out, and now it's like, oh my God, we need to have my period. I have to wait 2 weeks. I have to wait 3 weeks. It's all the sort of stress and mental energy placed on, again, this whole process, which could just be
easily preventable. And
if we use condoms
and with
birth control.
Increased stress, your periods are delayed.
Yes.
So that
So it's a vicious
adds to
cycle.
that. It's a vicious cycle, right? Like women come in and they're like, well, I had the morning after pill and I didn't bleed for 6 weeks after. I hear that commonly. Or I bled too early and I'm continuing to have cycles, like more than one cycle in a month, So it messes up. It's a lot of levonorgestrel. It's a lot of hormone that goes inside at one time. And if you're nauseous and you throw that up, it's not even that effective.
It's not that effective, yeah.
So I'm just saying, I think this is a good way to think about contraception options and what's available out there for you guys.
Yeah, I think the methods that the community is using now are not very effective, which is why we're seeing so many abortions in the community. It's so taboo. No one wants to talk about it. But myths around birth control themselves. So then people don't want to be on birth control because of multiple things that we just talked about.
Right.
Now tell me a little bit about, what do you think about, you mentioned we were on break, ovulation, like the fertility myths, like not feeling like people can get pregnant.
Thank you for asking that question. So I have women that come in and tell me, oh, I'm tracking my ovulation through this app on my phone. And I'm like, yes. And that would ideally work if you had a nice 28-day cycle and you're bleeding consistently, everything's fine in terms of diet and exercise and there's no concerns. But some women, let's be honest, nobody has an exactly 28-day cycle. You can have a 30-day cycle. You can have a 32-day cycle. I have women that are 42 days and consistently 42 days, and that's your normal. That is your normal. So ovulation sticks can sometimes be misleading in terms of ovulation because if your periods are not following that routine 28-day cycle, it might not be predictive of when you're ovulating.
So these women are not ovulating and they have sex.
And these women have sex thinking,
pregnant.
okay, this stick is saying I'm not ovulating, so let me go have the sex and be fine.
Yeah.
And that's a myth.
Another problem,
That's a myth.
Tracking ovulation.
It's hasty, right?
Problem.
It's imagine you're buying a car. Do you test drive a few and get all of the cars? No. You make sure that you're protecting yourself, right? Like you want to feel the comfort. You want to feel everything about it. You take insurance on it to make sure that it's going to last the way it is. Yeah. If we're making that kind of decision on a car, this is our body, guys.
Our body, yes.
Come on, our body, our soul.
Yeah.
And pregnancy is a soul, it's a very mentally, physically, emotionally invested process.
Oh, it's huge. And I think that's the problem. I think that right there is the key. It's the lack of awareness and respect for our bodies that get these people into these positions in the first place, get our population, I mean. I think that's a huge part of it. There's just not that level of self-respect.
I hear you. And that, again, is a cultural thing that we were talking about. And I'm trying sometimes to sit there and go beyond what's expected. As a family doctor, you and I both know we have 20 minutes to see a patient. Yeah. How much do you cover in this time, right? Do you cover about their diet and you tell them, hey, make sure you're exercising? Or do you tell them, hey, get your screenings appropriately, like get your mammograms done, get your pap smears done, get your FOBTs, like poop tests done? Like
Do you
this is
ever
something.
have- Like, do you ever divide it up? Like
I do. What I do
like
is
come back for the screening talk, right?
I do.
Like,
I
do that a lot.
absolutely use the complete physicals, which we have deviated from.
A
but we're
lot.
doing preventative health visits where I take that opportunity and discuss only prevention.
Only prevention.
Like we're not discussing anything else during that visit,
Except-
maybe one problem here and there if
Yeah.
it's a quick and simple. Oh, look at this rash kind of a problem, but I use that visit solo exclusively to see are their vaccines up to date?
Yeah.
Are the pap smears up to date?
So
Are the
much
mammograms up to date? Like when was the last time they had a shingle shot? You know, like when was the last time somebody checked their A1C? You know, like you need to use
much
these
prevention.
screenings because cancer is so debilitating. And I deal with so many women that are having cancers that may have been preventable if they were taking the proper routes and precautions, right? And I had a lady, Kenny, and this is the reason I started doing PAP days, and I don't think you're aware of why I started.
When do you do PAP days? Saturdays.
Saturdays once a month in my clinic, I do PAP days to
should
raise
do that.
awareness,
Yeah.
you know, to make
That's
sure
great.
what young women who don't have a family doctor or have a male family doctor or have a doctor that they're not comfortable with,
Yeah.
just come in, no judgment, no concerns, just come in,
Do
get
your
their
PAP.
PAP, go.
Go.
That's
you know, they
awesome.
don't feel
That's so
obligated.
good. Yeah, I've
That's
sent a lot
awesome.
of people to
So
those clinics.
one of the reasons I started that was because I had a 50-year-old lady many years ago now who had come in bleeding, vaginal bleeding. And she's like, I hate doctors and I haven't seen one in 15 plus years. And I smoke a pack a day.
Oh my God.
And I'm saying to her, like, I didn't want to do the PAP in the clinic on that day because she was knowing that she was bleeding and I was going to have a gush of blood all over my floor. But something about that patient
Yeah.
just made me want to do it. And she's passed on now because she had a 6-centimeter mass on her cervix. I could see that even through the blood.
Yeah.
And I sent her immediately to get a scan. And sure enough, it was cervical cancer, stage 3. And she refused chemotherapy. She refused, you know, any sort of treatment. Like she refused a hysterectomy. She's like, I seen my dad have lung cancer and go through chemo. And he was 91 and he passed because of that. I said, you know, no. Common things being common. At 91, you're not just dying of chemo.
No, right.
You're dying of old age.
Yeah.
So there are these myths of people associating these things, these random facts
She was
with
only
one
50.
another. She was 50,
It's not old.
had grandkids, only lived 1 year.
Yeah.
Well,
Didn't, yeah.
That was
It was very quick.
Well, and I think, see, that's what I think is really good. Like doing PAP days is really good because, and it's a nice thing that you offer it on Saturdays because people work during the week.
This is why I did that.
That's why the weekend slots are
Yeah.
just, coveted slots because people can get in on their days
Yeah,
off.
exactly.
And so I think, there's a lot of stuff within the community that I think we struggle with, and we've talked about that. I think, we've brought up a lot of topics today that could be covered in future episodes about other things that
Definitely.
we could focus on.
Definitely.
like,
Yeah.
Yeah.
No, everything that we talked about, especially a lot of information that's coming in for me, but it's for the audience especially the women, and because there's a taboo on a lot of the things that we talk about.
Yeah.
This platform, and the reason why we have this platform is why we're doing this episode, is to get the people to understand that it's normal conversations. These are conversations that you're supposed to be having with your doctors. You're supposed to be having the good touch, bad touch conversations. Like your parents are supposed to be having that with your kids, so that they don't go get sexually assaulted by all the relatives that they have, right?
Right.
And that's what you'll find in the community, especially in our community. It's a huge,
Yeah.
it's huge, right? And you guys see it all the time in your practices. And so having an episode like this, talking about women's health, and it's very important because there's so much. As you guys can see, you guys are so enthusiastic about it. There's so much information that's coming out. And I would definitely want to bring both of you guys back, and we'll do more episodes throughout the future here, and we'll set up times. But today's episode was focused on the outer, bigger picture of interception and understanding how important having safe sex. The pull-out method doesn't work. Okay, don't rely on it. Males, and something like vasectomies, like males don't talk about that, or they don't talk about to their doctors, and those preventions are there. So having these taboo conversations is a really important thing, and I want to dive more into it and into future episodes. And so we'll definitely have these conversations. PAP days are on Saturdays. We're going to put all the contact information for Dr. Chavali as well on in the episode below. And make sure you guys keep tagging, sharing, subscribe, hit that subscribe button. And we want to bring, if you have any questions, keep on emailing us, DM us, and let us know if we want to have a certain episode on a certain conversation. We'll definitely try to make that happen. Other than that, if we're all good to go.
Good.
Any last words? No? Good? Okay. We'll see you guys next week for episode 15. This was Women's Health with the Punjabi Pod. Sat Sri Akal.
Sat Sri Akal.